everybody. Today I want to talk to you about natural history studies and why it is important and why we keep pushing it forward, because we need to know as much as we can about everything related with v-ATPase conditions. Natural history studies are important because we get to know more about the v-ATPase conditions. We get to know more about the disease, more about their symptoms, more about the mutations that people have, and even where people should get clinical care. Natural history studies are also critical during drug development. Companies are always seeking to know more and more about conditions like ours. Traditional natural history study is done in a clinic setting or during a hospital visit, or through data that it's patient-reported data, such as the one that we launched last year with partnering with the RareX, the data collection program, where the patients report the symptoms and they report all the information, and we are able to get that information, track it over time. But all this means is that for us to have a nice, robust and useful data set that we can use for research, we will have to collect the data for about a decade. We don't want to wait a decade before we move forward with treatment and drug research and all of that. So fortunately, I am very pleased to announce that we have a new partnership, very easy, one and done partnership that you just have to worry about it once, and then they will do the rest. So I want to introduce to you to Citizen Health, how that it works. Really easy. So the patient, or in most of our cases, the parent of the patient, will log into our platform, and they will have to bring a list of all the doctors that your child has seen or is seeing, and give consent to Citizen Health to retrieve that medical data. They are a tech company, and they will use their machine learning platform to pull out all the critical clinical data from all the labs, all the medical reports, everything that you've done with your child, and have it all available in one place. That will then create a data set that can be used for research. That data set is going to be de-identified. However, all the data that they collect from the information they collect from you, they will be available to you, which means that they also represent a great partner for our day-to-day life, when every time we need to seek a new doctor or a second opinion or anything, we can just use their app to share what we know about our kids and share their data. So that's it. And the only thing you need is, it takes 5 minutes. You just log in, you give consent for us, for v-ATPase Alliance, to have access to your data. You give the identified data. Just want to make sure everything clear. You give consent for them to retrieve your medical records, and then AI will do the rest. So another great perk of partnering up with Citizen Health is that they do revenue share. That means that every time our data, each one of our data is used, and a company buys a data set that includes our data, all the patients that are in that data will get some sort of payment. So you don't need to do anything. It's just they will notify you and you will get the payment, which is very nice because they really do care about giving back. But I'm going to drop all the information down in the comments, and I hope to see you there.